I will now answer some questions from Monday's update. Several families asked what can be done to protect the people who use these hospitals, who is going to keep new mothers and babies safe. Following publication of the first report, the Chief Executive at the Trust, Louise Barnett, said, "As the Chief Executive now and on behalf of the whole Trust, I want to say how very sorry we are for the pain and distress that has been caused to mothers and their families due to poor maternity care at our Trust. We commit to implementing all of the actions in this report, and I can assure that the women and families who use our service that if they raise any concerns about their care, they will be listened to and action will be taken." Nadine Dorries MP, the Minister, said, "I expect the Trust to act upon the recommendations immediately and for the wider maternity service right across the country to consider important actions they can take to improve safety for mothers, babies and families. This government is utterly committed to patient safety, eradicating avoidable harms and making the NHS the safest place in the world to give birth. We will work closely with NHS England and Improvement, as well as Shrewsbury and Telford Hospital NHS Trust to consider next steps." In the days following the publication of our first report, NHS England wrote to all trusts asking them to review their maternity services against the immediate and essential actions in the report. And since then, they have provided £95 million in funding for maternity services across England to help them improve safety for women and families accessing their maternity services. Question 2. Several families have asked why nobody has been sacked or suspended pending the investigation completing. Also, they have been made aware that a large number of the managerial midwifery team have been suspended due to the review. Families asked what is being done to make sure the lower bands from midwives up have full support and enough staff. These are questions that I am not in a position to answer as I do not work for the Trust. However, Louise Barnett, CEO at the Trust, has given assurances that if you have any specific questions regarding maternity services at the Trust, they would like to help you as much as they can, and they have given the following email address for you to use to raise any questions specifically about maternity services at the Trust. It is sath.maternitycare@nhs.net. Or you can call the Patient Advice and Liaison Service on 01952 641 222 extension 4382 and they will do their best to help you. In June last year, West Mercia Police confirmed that they were launching an investigation into the care of mothers and babies who died or suffered serious harm in the maternity services at the Shrewsbury and Telford NHS Trust. Since the launch of that investigation, we have continued to work closely with West Mercia Police, as well as with NHS England and Improvement and the Department of Health and Social Care to ensure that families' voices continue to be heard. Families have been contacted and are assisting the police with their ongoing investigation. In addition, the General Medical Council and the Nursing and Midwifery Council, who are the professional regulatory bodies responsible for ensuring that doctors, midwives and nurses practice safely, are working with the review to better understand all concerns that raise questions about a registered professional's fitness to practice. Where there is evidence that a registered professional's actions or behaviours fell below what is expected and there may be continuing risk to people receiving care, they will investigate and take whatever regulatory action is necessary to protect everyone using health and care services. They consider all evidence, including witness statements by families and any information that is sent directly to them. They continue to engage closely with the review team by sharing information and advice so they can take the necessary next steps. A family asked, "Can you tell us what is happening with the Facebook page and how I can join this?" You may recall that we asked for families to come forward who were interested in becoming Facebook group administrators. Several families have volunteered and we are in the final stages of agreeing the arrangements for next steps. Once these have been finalised, we will let you know. In the meantime, if you would like to join the Facebook group, please email maternityreview@ockenden.com and we will send you the link. Another question. Several families asked, how many people have come forward? Are they going to be included? Are there specific families involved? Can you give us an up-to-date position on how the review is going? How many cases have now been looked at? My team continue with their work of reviewing care that families received, but I'm not able to tell you how many cases they've looked at so far. There are 1,862 families included who will have their care reviewed as part of the terms of reference. The incident categories as described in the review terms of reference, which you can find on the Maternity Review website, are maternal death, neonatal death, stillbirth, HIE or baby brain damage, and maternal morbidity, significant harm to mother. We are aiming to publish our next report towards the end of this year. We do not yet have a date, but we will update you as soon as we know the arrangements for the next publication. Several families asked, can you confirm if at any stage families will be spoken to about their individual case and findings? We have not yet agreed the arrangements for feedback to families. We know that this will be after the publication of the next report, but we are still to confirm how this will take place. Again, we will inform you once we know. A family asked, will you be contacting all parents? If so, when will this be and what information will you require? This question may be about family meetings. The COVID pandemic has significantly impacted my ability to travel to Shrewsbury to meet families. I will be in Shrewsbury next week meeting families and are planning to do so each month until the publication of our next report. Those families we are planning to meet with face-to-face will be contacted in due course. If you would like to share your personal story, you can email this to us at maternityreview@donnaockenden.com, and you can email to arrange a telephone or a Zoom meeting with a senior midwife. We will take notes from these meetings or record them and will ensure that the team reviewing your care has access to your story and that your voices will be heard. Some families asked, when will issues with children born in the 1980s be looked at? What is the progress on older cases where access to records may be an issue? My team continue to review all cases within the maternity review, including those before the year 2000. However, there may be cases where we will be advised by the Trust that in accordance with their medical records policy, medical records have been destroyed. This means that we will be unable to review the care you received as per the terms of reference for the review. However, central to this independent maternity review is the family voice. Extracts from your story, if you have shared this with us, may be referred to confidentially in the next publication. If this is the case, we will contact you beforehand to advise and seek your consent. A family asked, can I have some information please about the support groups? We have ensured that there is a range of support for families. If you email support@donnaockenden.com, one of the team will contact you and help you to arrange to speak to a member of the support team. Thank you for taking the time to join me today. I hope that you have found this question and answer session helpful. The video from this session will be posted to the Maternity Review website within the next week. I hope that you're able to join me for the next update in about 8 weeks' time. This is planned to take place on 13th of July at 9 a.m. and 14th of July at 5 p.m. and we will send a reminder email to you nearer these dates. I hope that knowing these dates in advance will help you with diary arrangements. Thank you very much for joining me today.